we all know how powerful it is when the right person or the right student meets his next employer. When the right bioprofessional or a representative of a company meets the another the right contact person in the company next door, next city, and we all know how powerful it is that a person just hears about the right advice. And that's exactly what we JLM BioCIty team members and me, Hamutal, the CEO of JLM BioCIty, are trying to do together with you today. So we're very happy to be with you here today after the COVID restrictions and a face-to-face event. And we started by having a special session for students that introduced the industry to students. So I would like to thank the students that participated in this session, and also three special people. I would like to thank you all for being here with us today, and actually the CEOs and CSO of the company, Guy Goldman, the CEO of Olive Diagnostics, and Ami Gotliv, the CSO of Omnix Medical. And yeah, sorry, I forgot your name.
As far as we can get.
For providing very important stories, very important insights, very important advices to students, and for the opportunity for them, to actually ask you their questions about the industry, and to understand that they can network and they can progress using networking. I would like also to thank Azrieli College of Engineering for hosting us today, and to invite a key person in this institution, Professor Debbie Shalev, the head of Pharmaceutical Engineering Department. She actually moderated the session today, and she leads the amazing RAFRA program that was initiated together with JLM BioCIty to introduce the industry to students. I would be very happy if you could, Debbie, share your thoughts after the session today. Thank you.
Thank you. So, good evening, everyone. It's wonderful to see people here in person after seeing everyone in little black squares. It was great to host students today. This was the first time that we had students meet in an independent session, and I'm going to get the name right, Ayelet Dillian Mashiach? Right. Dillian Mashiach, Guy Goldman and Niv Bachnov, for coming and speaking to our students and giving them the opportunity to actually meet someone in person from the industry. I would like to ask all of you to be open to come and meet students if you should be asked by Joe. We have people in the audience who've come to give lectures in the framework of the RAFA program in memory of Shmaryahu Levine, which is an enrichment program for our students. I would like to encourage all of you to consider funding such programs for students. It gives them the opportunity to learn during their studies about the world that waits for them ahead of time, to hone their skills and to direct themselves from a little earlier. And I'd like to thank Hamutal Shachar and the JLM team and Joe and everyone else for organizing these wonderful events that gives us all the opportunity to get together, and I wish you a very enjoyable evening. Thank you.
And especially Joe Van Buren, co-founder and president of JLM BioCIty, Ms. Abigail Fridge, co-founder of JLM BioCIty, and also Ms. Liana Naim and Ms. Sarah Gadansky-Cohen for their work towards this event. And I would like to thank our panelists for today. We are concentrating today on a IP, intellectual property strategy, and the option to use it as a tool for business development. And as always in JLM BioCIty events, we're going to hear about the topic from several points of view. So we will hear about it from the point of view of IP attorneys. We will hear about it from the point of view of companies and investors. And we also will hear about it from the point of view of tech transfer organizations. Our first speaker will be Dr. Bat Ami Gotliv, IP strategy designer and the IP attorney. Bat Ami, please.
You definitely need to show enablement. You cannot get a patent about ideas. You need to get a patent about something that you actually practice. And we are talking about the industrial environment. However, this is not the most important slide in this presentation. Because if you are going to concentrate only in getting a patent, you will stuck in this stage. This stage is simply the connection between the R&D and legal. And you can earn much more than that. In order to do so, you need to complete the triangle by having the alignment with your business plan. And when you are aligning your legal, R&D, and business plan, you end up with powerful, very significant tool that actually make the difference between a good startup and a successful startup. I think the best way to demonstrate is by telling you a story, and I will take you back to Indigo Digital Printing, a small Israeli startup that was dealing with liquid ink and high-speed scanning and printing methodology. And Indigo was successful in utilizing very powerful patents that actually make their competitors paying about $200 million for licensing those patents. At some point, HP was tired from paying all this money and acquired Indigo for $380 million. This was back then in 2002. And the guy that was behind this successful acquirement was Benny Landa. And Benny Landa made this phrase, patents are like minefield. I will add to this phrase my belief that IP strategy is actually playing a chess game. What is the benefit that you will earn out of it? By using IP as your business tool, you're actually going to design your company future. We'll learn about it a little bit later. You're going to identify the obstacles around you. You're going to create your own obstacles. You're going to have your global IP fingerprint, and we will talk about it also. And you have the opportunity to outflank competitors. Now, there is a lot to tell about IP strategy. One of the things which is not very popular in the biotech industry is, for example, why to have a patent at all. Sometimes you need, first of all, you need to realize that when you have a patent, you are becoming public. You need to expose your technology to everyone else. And sometimes when the technology or specific angle of this technology is not so clear, and it's not there is no possibility to reverse engineering and to understand what you're doing, maybe you don't need a patent at all. Maybe it's good enough to have a trade secret. But I'm not talking about trade secret, I'm just letting you know how complicated it's that, how much effort you need to put inside this business tool. I will concentrate now on the patent quality. Simply because not so long time ago, when an investor was looking on your technology and making a due diligence, They were asking you how many patents you have. And you will say a certain number, and this was satisfied to get the investment. Today, investors become much more sophisticated, and I hope one of them is sitting with us here and will talk about that. And they are not talking any longer about how many patents you have. They are talking about the quality of the patent. And what we are looking for is having a strong enough patent. Now, what is a strong patent? If I'm talking from the pharmaceutical industry, I believe the answer is quite easy. As long as you have new molecule, new compound, new use, you have a strong patent. Because once there will be a generic, they will need to be the same like you. They will need to use the same API for the same indication. It's becoming much more complicated when you are talking about the biotech industry in general. And I was trying to give you some tools, what is a strong patent. I think the major message here is to concentrate, again, on your business plan. Not to talk about a certain patent, but to talk about the overall product. And not to concentrate on the technical aspect of your product. If you are concentrating on the technical aspect of the product, at the end of the day, there is a smart engineer back around the corner in your competitors, and is going to design around this patent. However, if you will concentrate on the concept, and you will try to claim this concept, you have much more powerful tool. Let's take, for example, medical device. You design a device, you have a certain valve that you know how to made of, you know exactly where it is as part of the medical device. If you're going to claim it in the patent, for sure someone else will find somewhere else to put the valve or another material that it can make of. But if you will understand what is the role of this valve, what is the function of the valve in the entire device, and you will go to claim it in the patent like the concept and the function, you end up with much more powerful patent. So I think what you need, first of all, is to understand what is your core technology, and not the core technology now, what will be the core technology in 10 years from now. I think the most important thing is, first of all, to identify your partnership and the license relationship. Look, it's very clear that it's very hard to get a product out of your biotechnology. It's very hard. It's very hard because you need a lot of effort from the R&D. You need to invest a lot of money. The one that can help you to eventually take this product out there, and so society will benefit of that, a large organization, a large company. Imagine yourself sitting in the conference with such company, having this patent after it's published. And imagine what will happen behind the scene after you leave the room. What are you going to do with that? Immediately when you're leaving, there will be a discussion how to design around what you were just presented, what are the holes in this patent, how they can benefit from it without you. If you will have a broad enough patent, you will be in a different situation. But there is a warranty here. Broad enough patent doesn't mean this is a strong patent. In order to have a strong patent, you have to prove a different element of your technology and give a support in such a patent. So it's not enough just to design it and claim it as a broad. You need to support it with your R&D and to provide different examples that eventually will support this broad concept, so you will end with a strong patent. Do you know where are what is the most popular country for filing patents these days?
China.
Yeah. And this is the situation. This was taken from whiteboard. This is a slide from 2019, but the trend is ongoing, which means China is definitely important. There is an enforcement of patent in China, and there is a lot of filing of patent in China. And this led to another aspect of what is a good strategy. We will need to think about the enforcement. Eventually, when you would like to use your patent and to protect your invention, you would need to identify the one that infringed the patent, and you will need to go to court and to prove there was an infringement. How are you going to do that? You can do that only if there are specific elements in the product that you grab from the shelf that you will be able to identify. So when you're drafting your patent, think about the enforcement. Think about what is the fingerprint of your product that allow you to go to court and sue the potential infringer. Take, for example, a mixture of polymers from different sizes. This is your product. You can definitely protect the polymer. However, if you will spend money on analytical method and you will identify the profile of this mixture, you will end up with a patent that describes either, for example, the extra D of this, if it's in crystalline form, or the GC and the retention time that is specific for this mixture of polymer. And again, this is your tool for enforcement. Another question that you will need to ask yourself, who is the potential infringer? And I'm going back to China. It is possible to enforce patent in China. But for example, take again a medical device that contains a consumable part. Consumable parts are easy to mimic, are very cheap to mimic. So you will end up with a lot of Chinese companies trying to produce the same consumable part. Are you going to enforce the patent for each one of them? Are you going to send warranty letter to each one of them? Probably not. A better strategy would be to take this consumable part and claim it in a patent as part of the whole device. And in that way, you're actually targeting not the small company in China. You are targeting the bigger company that maybe will produce the whole device, or the one that will sell it or market in other countries. And then the potential to enforce the patent are much more advanced. One of the major obstacles in the patent system is that you need to be the first to file. You need to do it very early. You need to do it before your competitors. You need to do it before your own invention, before your own publication, before you are talking with your investors. It's a real obstacle, especially for small companies, small startups that would like to have investors. However, I think you might think about it as an opportunity. This is an opportunity to hold the crystal ball and to look inside it. If you will design it well enough, you actually will end up with a growing portfolio of patents that is growing during time. And this will be your tool to live in this very tough and dynamic environment. One of the ways to handle this crystal ball is to do patent search. And I know that startups think that patent search is expensive, is taking a lot of time. You end up with a list of a lot of patents that you need to review. This is not exactly the situation. Daniela and Yunit, Daniela and Yunit are my colleague, and we are collaborating, doing searches. You can approach them at the break and ask them about patent search, and you will be surprised that it's not so expensive like you think of, and it's a very useful tool. And I'm not talking here about the buzzword of freedom to operate. Startups think that they will need freedom to operate. They will need, but not at this point. Freedom to operate is actually an opinion that we are getting when we have a product and when we mark the product in a specific country. At this stage of the initial point of the startup or in the middle stage startup, we don't necessarily need freedom to operate, but we do need to open our eyes. We do need to know what is going on there. And this is what I recommend first do a landscape search to understand who is your competitors, to understand what will be the obstacles, to have a tool to design your R&D, which is a very important tool. You definitely can have a specific search for the competitors that you heard about them, you saw the poster in a conference, you think that you might have some kind of problem with them. You can have a search about your own invention to understand what is the chances to get a patent out of this. And in such a way to design your patent and draft it in a better way, which eventually will reduce the cost of the whole prosecution of this patent. And at the end, you definitely would like to know if you are infringing other patents or not, and this is what we call a clearance search. I think the best message here is that if you would like to use this tool and have a very significant tool for your startup, you need to adapt a business-driven approach of patenting. You need to involve your R&D in that. The R&D persons are very smart. They design your product. They have the specific condition or the specific medical device that is going to be there. But when you teach them about the broad scope of patents and how strong and significant it can be, you might open their eyes and you can get out of them the alternative, the future. And in such a way, you will make the difference. I hope I convince you to adopt a patent strategy. I think it's important. You have a strategy for finance, you have strategy for marketing, you definitely need a strategy for your IP. And I will be happy to answer any questions.
My name is Drucker. I'm a serial entrepreneur and investing a lot of, not want to say a lot, but a few biotech companies. My point of view when I'm checking the patent area or industry is how it creates the value or increase the value of the company. About 80% of the value of companies as of today is related to the IP. Okay? And as we are talking about the biotech industry, it is even more dramatic and even more important since the pharma industry, the biotech industry, does not appreciate things or knowledge or developments or even products that are not covered and not protected because they cannot make money of it. Very simple. So if someone wants to build a company, he needs to protect the IP. Saying that, as the Ami said, we don't need to say or to disclose everything. It's very important to keep the Coca-Cola recipe beside in order to have also things that if someone will break our patent or even if someone would like to mimic what we are doing by reverse engineering or bypassing our IP, still he will need us in the production process or other aspects of the IP that we are talking about. More than that, as of today, more and more public companies are publishing almost every new patents, new applications, new grants, patents that they got, because they understand the public, the audience, very appreciate this kind of achievement. And again, usually it creates a value increase in the public. And we, as investors, we like to see our investment, getting better. When we are talking about what we are looking in the patent IP area, it is a little bit complicated because we are not looking for a specific thing. It's a holistic view of several things. Things that we have to think in advance, and things we have to do today, and things that we have to follow and make sure that they will be done in the future. So, first of all, we have to understand the environment. And we are talking about biotechnology. Biotechnology is very niche kind of biotechnology. It's a lot of small but very big different activities. And for example, let's say that we are dealing with a specific molecule. We need to understand what kind of environment this molecule is in. Let's say that we have a molecule for targeting cancer treatment. We need to see the competitors. We need to see the patient compliance aspects. We need to see who are the clients or the doctors that are going to refuse to implement our idea. In the end of the day, we have to bring a product to the market. And we have to understand the whole environment of the market. If we are going to make doctors have less patients, maybe they will not implement our solution. It has to be in a different aspects, fits to the environment of whatever we are developing. But Ami spoke about FTO, and we are doing it day to day. FTO has different levels. The simple FTO is just to know where we are standing. Meaning that let's say that I have a patent, I would like to understand what kind of head-to-head competition I have with my potential competitors. I would like to know what they are planning. I would like to know where I can put my patent on the table and have it granted. Or maybe should I do during the R&D a different path in order to kind of bypass the fence that was established by another company. This is very important in the very early stage of every company. Because if we don't know what are the obstacles, it will be very difficult to be able to get a granted patent. And even we will get a granted patent, it doesn't say we can operate it, because if it's under another patent, we don't have really freedom to operate. And this is very important, because if we are not doing it in the early stages, we might be in a situation where we spend tens of millions of dollars, years of hard work, and we can do nothing with what we develop without getting a license from the other company. When we know the environment and we know where we are standing in the FTO aspects, we need to decide what are our IP goals. Meaning that if we had a discovery, you know, we could think that we will run, file a patent, hope it will be okay with all the discussions with the patent authorities, and that's it. But we have to think, as Ami said also, what we would like to achieve when we are filing the patent. And this leads us to our strategy. Strategy as a company. Ami said that it's hands to hands with the business development and the IP. There are different reasons why to file a patent. I can file a patent because I would like to develop a product, but maybe it will be a better idea to file a patent to block another competitor, so he will need to get a license for me of whatever he is developing. So I'm getting a kind of a free ride of what he is investing. So strategy is not only how we are filing or what we are going to file in the patent, but also what is the purpose of the patents, what we would like to achieve when we're filing this patent. And this is very important because it influences the dialogue we have with the patent lawyers. Okay, so we did the research about the environment, we did the FTO, we know what we want from ourselves, we know our strategy. There is also a strategy regarding the submission. As all of us know, there are a few stages. There is the provisional stage, then there is the PCT, and then it's country by country, the national phase. So there are times that in the provisional we like to gather as much information we can, but if we found that in the environment research, the system or the ecosystem or the field that we are working on is booming and a lot of companies are filing patents day after day, maybe it will be better to file a half-cooked patent just to put the fruits on the ground. And then we have about a year to develop it and to gather more scientific evidence to support the patents. This can be done in the first year after the first patent, after the first filing. There are different strategies in this field, but Ami can elaborate it later on. But it's very important because we can make changes in this year while we have prior art. We are getting the time of the submission compared to other companies. Assuming we file the patent, we reach the PCT stage, we got good feedback from the patent lawyers, and we are now working country by country. From our experience, it's very, very important to make sure that we will not be surprised. And we are doing it by periodically check of the market by different hit words or search engines, just to make sure that we didn't miss anything. And miss anything means that a company that we didn't know, we didn't pay attention, filed a patent that is blocking us or may block us in the future, or maybe another company did another thing that gives us ideas to increase our patent, and so on. I just want to say regarding the strategy, from my experience, there are two main kinds of patents. There is the umbrella, there is the specific. And when we are talking about startups, from our perspective, it's better to have in the first stage umbrella patent, a general patent describing the discovery and the different fields that this discovery is covering. But then as the development is progressing, it's very, very important to start and have much more specific patents and increase the tree of the patent portfolio. It's very important to have strong patents, and as it's more specific, it will be more strong. But during the development period, it is very important to have the umbrella patent blocking other companies to compete us head-to-head. When we are talking about investment in the startup companies, and this is what we are doing, it's not only important to think about the IP and the strategy and so on. It's also very important to understand the vision, where the company is looking to be 10 years from now. Because in the end of the day, the research or the development we are doing needs to meet the business plan and the goals or the targets that the company is looking to meet. And it's also very important to define in the beginning if we are looking to develop a product A to Z, or we are looking to license it out as we're moving forward. All of us know that to develop a drug costs hundreds of millions of dollars. And although we are very smart, all of us, we are very small. So we have to think about it also when we are filing the patents, because it may influence our ability to license out the technology. As much as we have more specific patents, down the road it will be easier for us to license it out per indication. So again, to have umbrella covering, blocking the area, and then much more specific patents to have it to specific areas. It's very difficult to assess the valuation of patents in startups, since usually they are in provisional stage, maybe in the PCT, but that's it. And we don't know actually what will be, what are the chances that those patents are going to be granted, and what are the claims that are going to be granted. And when we are doing valuation of a patent, beside all the research and strategy and understanding the company and so on, it's very important to know who we are working with. Because creating a patent, building it, beside of the hard work that need to be done, people have to be devoted for that and go sleep, eat, drive, think about the challenges, how to bypass them, how to overcome them, and then to take it forward. So when we are investing, we're investing in the IP, in the patents, and so on, but in the end of the day, we're making our decision because we're investing in people. And I'm saying that because we're talking about numbers and IP and so on, and at the end of the day, all of us are in the biotech industry, and we understand that the most valuable thing is not the outcome, it's who is making the outcome. And those are you. Thank you.
So how many people in the audience are entrepreneurs? How many people did take technology out of a university of or a hospital before? How many wants to do it in the future? Okay, so we have relevant audience here. So I want to tell you the perspective of the technology transfer company and of the institution that you took technologies out of, or you will do it hopefully in the future, because it is our goal to let our technologies go. It is our goal to identify the ideas, to write the patents, and we wish entrepreneurs and companies to take and develop these technologies. We don't develop technologies ourselves, not in the hospitals, not in the universities. Our aim, my KPIs as a CEO of a tech transfer office, is to create as many companies as possible, is to license out as many technologies every year. So the interests are aligned. The thing is that we need to think about the goals and the long-term vision of the universities and the hospitals, and this is sometimes in a conflict with entrepreneurs and with the companies, and our mission is to manage these conflicts, because as in life, I think everybody has conflicts. We have conflicts in the family, we have conflicts with friends. The mission is not just to ignore all the problems. Our mission is to try and manage them and get to a win-win situation. So Hadassit is the technology transfer company of Hadassah Hospital that you all know in Jerusalem. I am within Hadassit in the past 8 years. I am a biologist by training. I did my PhD at the Faculty of Medicine of Tel Aviv University. And a few months after finishing my PhD, I moved to the dark side, to the business side, and I became an entrepreneur. I started a startup company developing anti-allergic drugs that was taken from Tel Aviv University to one of the incubators. And from there, I continued. I worked for moat. It's the technology transfer company of Tel Aviv University. And I see my expertise as sitting on the edge between the academic world and the business world. And this place that is called technology transfer is very, very complicated. First, it's the art of translation. We need to translate from the academic medical language to the business language. This is at least as complicated as translating from Chinese to English. And as I said, we need to manage conflicts, because the minute a scientist or professor has an IP, has an idea, the list of conflicts just starts, and we need to manage it in the way that everybody will be happy, to make it a win-win situation, and to allow a medical product to go all the way to the market, because this is our goal. And the list of conflicts is really huge. In the academic world, the researchers want to publish, they want to share the knowledge, they want to go and publish in the best scientific journals, and they have what we call social responsibilities for the journal, for the society, for the university, etc. The industrial goals are totally different. Company needs to make money. So in our medical world, it's also to develop drugs or to develop medical devices, to develop solutions to the benefit of all of us. But in the end of the day, if we won't be smart enough to find the investors that will be able to make money out of the ideas, nothing will happen. So our responsibilities and our goals are totally different, are more for the product development, for secrecy. Before you write the IP, you shouldn't publish. When you write the IP, you want to keep silence, at least till the patent will be published, and your responsibilities are for your shareholders, to your shareholders, and not to the university. And it costs a lot of problems. And I want to start and talk about one example that eventually was a very successful one, but had its hiccups in the way. Doxil is one of the most successful drugs that came out from Israeli academia, and especially from Jerusalem. Joint patent that was developed between Hebrew University Professor Bernholz, and Hadassit oncologist Professor Gabizon. They created the patent together, and the patent was about a new delivery of drugs, cancer drugs, back in the 80s, when chemotherapy was the main drug that was used. Nobody was talking about immunotherapy yet, and the main problem was the toxicity of the chemotherapy, and they invented the liposomes that can carry the chemotherapy inside the body with making as minimum harm as possible if you compare to just naked chemotherapy or naked drugs that are given to the body. The Hebrew University Technology Transfer Company Yisum and Hadassit of Hadassit worked together. The technology was licensed to an Israeli startup entrepreneur that raised the first sum of money, started preclinical trials, and failed. He ran out of money, and the company didn't go anywhere. Luckily for us, and luckily for the world, I think, the license agreement was such that when the company failed, they had to give the patent back to the university and the hospitals. And the TTOs that have their own budget, TTO, Technology Transfer Office, or Technology Transfer Company, it's the same. Both we and Yisum took the patents back, continued to pay for the next stages, because the minute you stop paying, if you go into the PCT stage and you don't have as a startup company money to pay for it, the patent dies, and you can't restore it, or you can't start again if the patent was published. So, and as was told before, the budget is just increasing over time, so it's very, very important to have deep pockets. The patent came back to us. We took care of it for additional few years, and then it was licensed again. It was licensed again to an American company called Alza Corporation. It was one of the first companies in the world that did drug delivery. And Alza was quite successful. They continued to develop the product. It went into clinical trials with Alza, and then Alza was bought. Alza was bought by a small company called Johnson & Johnson. And then Johnson & Johnson had all the pipeline of Alza, and they had to decide which of the project they are going to kill and which of the project they are going to continue. Luckily for us, the Doxil project was good enough for Johnson & Johnson to continue and develop, and luckily for us, the license agreement had terms that included the ability of the company to do sub-license, the ability and also the buying of ALSA, or the chance that ALSA will be bought, was also covered in the license. So both Hadassah and Hebrew University were not harmed by this deal, but the opposite. And both institutions got royalties from sales of the Doxil for many years. Unfortunately for me, it was before I became the CEO of the company, so I can't write on my name even the tale of this success. But it is considered one of the big successes that came from Israeli academia and hospital. Another story that's a very recent story that was published last December in Business Wire and in Israeli papers was about CellCure. CellCure is a Jerusalem-based, Hadassah-based background, Hadassah IP, that is fully owned or almost fully owned in the last few years by a US company called Lineage. CellCure is developing a very interesting technology based on embryonic stem cells that were developed at Hadassah by Professor Benjamin Rubinoff. And we have few lines of clinical grade stem cells that CellCure took to develop a drug cell therapy for macular degeneration. Dry macular degeneration, huge disease with no current cure. That's another interesting story because the company started in a totally different way, totally different direction. And last December, one of the biggest deals in the CellCure area was signed with Genentech of Roche. Genentech took sub-license from CellCure. The company was not bought. They gave sub-license to Genentech. Genentech will now develop the drug in phase 2, phase 3, and hopefully will get cell therapy for the market. This is considered to be the biggest cell-based therapy, cell-based deal in the world ever outside of the oncology market. Deal that can come all the way to $670 billion only in upfront and milestone payments before the royalties from sales, and only the upfront was $50 million. Because again, we had a good license deal, and on this I think I can put my mark and my signature. It was in my time, Hadassah get percentage of every dollar that the company is getting from Genentech, and that's very important to our success. Now, so this is Professor Rubinoff that started the development of the technology back in 2003, when a consortium was established in Israel to start and develop cell-based therapies in Israel. See how many years it takes from the initial idea to having a real substantial deal. And this is in a nutshell the history of this story. So CellCure was created in 2002. The first idea was to go through to CNS indications. Then the company changed its direction to AMD, to ophthalmology. Clinical trials started in 2015. 2017, the company came to us, CellCure, and their owner Lineage, and told us we must change the license. With this license, we cannot go on. We want to do some changes, and there was a whole renowned negotiation about it. And the deal I was talking about was signed in December 2021. So almost 20 years between the beginning and the real, and this is not even the real success. The real success will happen when a drug will be in the market, and this will take a few more years. Now, in all this value, on all this roadmap, the patents are crucial. And if we would trust only the first patent that were there in 2002, Hadassah would have nothing now, but because the patents would be expired. But along the years, the company worked with Hadassah all the time because they needed the expertise of the professor, and our point of view of the patents and how we share with the company and how we work with the company is very, very important, not only for the company, but also for us to make it a win-win situation. So when you want to take technology from a technology transfer company, I think there are few main key factors for success. First, you need to evaluate the technology and the IP, as was discussed here. And the most, I think, hard or problematic, the biggest challenge at this stage is that usually when you take technology from an academic institution, a hospital or university, that you don't really know what will be your product. And as was said before, you need to protect with the IP your product. You don't want to protect the technology or just the idea. So working with the scientist, especially in the first year of the company, and making the IP strategy following the definition of the product is very, very important. And you need to understand the boundaries of the IP that you get from the university. Sometimes it's only a preliminary patent and you will need to add more. Sometimes you get a lot of know-how that you should keep and you should continue to work on before you get the best patent in IP. And you need to understand the needs of the academic institution. And the successes I told you before are a good example of companies that could work with the academic institution. You need to realize that for the academic institution, it's very, there are some needs, and these needs are not always or almost never just about the money. It's about the IP. It's about the ownership of the IP. It's about if this IP will be successful in 20 years, how will I, the university or the hospital, be part of this success because I was the source for this IP. And it's much more important to the institutions than to negotiate with you X milestone or Y milestone or royalties of X% or royalties of X minus 2%. So understanding the issues is very important, and I think that the best advice I can give is when you go to negotiate with an institution, take with you a lawyer that understands licensing with academic institutions, and luckily we have many like this in Israel. If you come with an attorney that doesn't understand, it's a nightmare for both sides. You need to assess if you want to do additional work at the academic institution, usually, especially in the medical area, working within the laboratory and with the researchers, with the inventor is crucial for the success of the companies, because they are the people that understand the technology, and the physicians also understand the market and also understand the market need. And having the first 2-3 years of a startup working together with scientists, I see this as a very important part of success of the company. And the case of Professor Rubinov, that is still working with the company today after more than almost 20 years, is a good example for this success. So you need to secure funding to do this, to fund the research. And as said before, it's all about people. When you go and talk with the scientist, you need to see that the scientist or the physician that will be, that you will take his technology, these are people that you would like to work with. This is very, very important. So we also think about the business models. We also think about the product. We also think what can be the outcome of the research that is done today. So we do our assessment as the company must do, and if we can become aligned, looking in the same direction or seeing the future of the company in the same eyes, then we can succeed doing business together. And also you need to understand that for us in the universities, starting a startup company is not always the best model. And especially in the pharmaceutical area, guys, most startups fail. Most startups don't succeed in raising enough funds to go to the next milestone. And then good ideas get lost. Good ideas will not be developed because the patents will pass, the patent life will become too short, the company will take a wrong business direction. And sometimes for us, it's better to go to an existing company, to work with people that know that what they are doing, that did this before, and give a license to an existing company and not a startup company. So we will not get equity in the company. We don't care. We care more that the product will have a real chance to be developed. And my last slide is I'm always told, okay, what are the terms? What are you looking for when you give a license? So I'll give you a very, very short, a few seconds overview of what are the principal terms when we give a license to a company. So if relevant and possible, we would like to get research funds from the company that's taking the technology to the lab of the researchers, of the inventor, of the principal investigator, and it will always be money that will help the company. So it will be to fund research under a research plan that the company needs to continue the POC, to do additional work that will help the company to get to its first milestone. So this is why I said only when relevant. We do ask for upfront or license fees. We know that in the US, upfront payment are much more typical, and we see them in almost all companies. In Israel, startup companies struggle to pay upfront money. So usually this term, if not possible, is taking off the table quite fast. But then some certain of license fee will go in the second, third, or third anniversary of the license. And this is like showing us that the company is serious. Because our worst fear as a technology transfer company is shelving of the IP. And we know that if the company will not have money, or if the company will have 3 products or 3 projects in parallel, and they will run out of money, they will they can drop 1 or 2 projects. Now, if they don't have to, they will not tell us, because when a company goes to an investor, it's better to show him that they have 3 projects that they are working on. So they will not voluntarily give the technology back to the TTO like the startup with the Doxil did. They didn't do it voluntarily, it was in the license. So if company doesn't have money to pay license fee, so they will give us back the technology. This means that they don't develop the technology anymore, and we will try to license it again. By the way, the story of the Doxil is not unique. I think that most of our, or many of our success stories are such that were licensed the second time after the first company failed. Milestone payments, when company develop a medical product and they go into phase 2, phase 1, phase 2, go to the FDA, get marketing approval, all these are milestones where the company reduced the risk and the company is now worth much more. And these are the times when we ask the company to pay us a certain amount of money as to be part of the success. Sublicense receipts, that's very important. If a company does sublicense receipts, so the TTO asks to get some percentage of this sub-license, and of course running royalties. When a product will be in the market, the university or the hospital will want to show to be part of the success and to get a percentage of these royalties. All the numbers, of course, must be such that future investors will look at the agreement and say, okay, this makes sense. I can invest in this money and make money, and the money that should be paid to the university or the hospital will not be so big that the whole business model will fall. And the last thing is when we give the technology to a startup company, we ask for an equity or an exit fee. And this is or, and with us at Hadassit, we give the company the right to choose. Usually we used to take equity in the companies, and then the investors told us, but you are, okay, so you have shares, but you don't have money to participate, and we don't want you, the university, as a shareholder, because you will not answer fast enough when needed. We want the cap table to be as clean as possible. So with this, we said, there came in the idea, we can ask for an exit fee, a very small amount of exit fee when the company will make an exit, but then investors came and said, this is not fair. With an exit, you're not diluted. So if you get an amount with the exit, and I, as an investor, invested 10 million or 50 million or 100 million, you will get the same. It doesn't make sense. So from my experience, I'm telling the companies, whatever you want, whatever makes sense to you, you can pick one or what's best to your investors. And as I said, usually the numbers are not, of course there is negotiation, but numbers are not the reason why technologies don't being taken by entrepreneurs and developed outside of the university. So I hope I gave you a different point of view of how we see our IP and what we think should be done when entrepreneurs take this IP. And as I said, I think that the most important point here, that the minute we give an IP to an entrepreneur, and even before, our goal is the same. Our goal is that the entrepreneur will be successful and that good products will go out there and be in the market and help patients that started